Today, I have the privilege of speaking with Dr. Sandhu from AscentX Medical. Dr. Sandhu, how are you today?
I'm doing fine, and thank you for inviting me to this interview.
Dr. Sandhu, thank you so much for joining us today. Can you please give us some of the symptoms a person with GERD has and how to identify that you have an issue with GERD? And please do correct me on this.
Well, the most common symptom is heartburn. It's a very distressing burning sensation that happens uh, in the midline of the chest. And the patients usually describe that things that exacerbate this are like bending over when after they eat large meals. And, you've seen those ads of antacids where somebody's had Mexican dinner or something spicy, and now they're burning and they're thumping their chest, and then they have to pop this to get immediate relief. Um, it, so this happens. This can also happen while they're laying down. So what you can imagine when you're sleeping and you get this reflux, and then you wake up choking, coughing, or say you're in a meeting, like you're conducting an interview right now, and then suddenly you get this reflux, and then you start coughing. Um, all that causes anxiety. It feeds into uh, the patient's ability to have confidence in themselves in those situations, and then they're afraid to go and sample food. They restrict themselves because they know if they try certain things, then or if they try a certain amount, then they're going to get into immediate trouble. And then after that, they say, oh gosh, I have to take this pill every day. And, for how long? Lifelong. Now they start reading about the side effects of the medications. So it's a pretty severe quality of life uh, impact that these patients feel. And they would do anything to get relief, even symptom relief is so important for them. And while these pills give symptom relief, we are talking about trying to fix the inherent defaulted mechanism that is resulting in this reflux.
You know, Dr. Sandhu, I was reading your background and I wanted to know why did you select to use your talents and your professional expertise at AscentX Medical? What was the catalyst that caused you to join this team?
Well, I have an interest in reflux disease because it's such a huge problem. And I'm also an interventional gastroenterologist. So whenever I see patients, uh, I'm always devising approaches whereby I can help them by doing something to change either the biology or the mechanics. And I had some really good success stories with uh, a compound that was injected into the gastroesophageal junction by another company. But unfortunately, it ran into trouble, and I was very disappointed. And that left a big lacuna in this area where uh, gastroesophageal reflux, there was medications, there was invasive surgical approaches, but there wasn't any uh, durable, scalable, mid-level approach, which was less invasive and more applicable in an office setting. So AscentX approached me with this biomaterial that they had in mind. I looked at it and immediately I felt that this is a very interesting concept, and I would I wanted to be a part of it and be involved in this.
When I was speaking with Larry Brago, your CEO right now, he was explaining how you've been instrumental in the company in helping them understand the correct terms to discuss with shareholders and investors out there. So, biomaterial, this G125 is the that is treating GERD. Is that correct?
Yes, that's correct.
So, for those of you out there that may have no idea what GERD actually is, I was surprised when I threw it at a couple of my associates, but they were quite familiar with this problem. Can you give us kind of a definition of what GERD is and how many people it actually affects out there? I think I saw a conservative estimate that this market may be as large as 60 to 90 million and as high as maybe half a billion in the United States.
You're correct. It's a huge market, and there are a large number of patients who suffer from this. Uh, to explain this, the stomach produces acid, and that helps you digest food. And the acid is kept in the stomach by a barrier between the esophagus and the stomach, which is called the lower esophageal sphincter. This is helped by the diaphragm. And so all these anatomical structures, they act as a barrier to prevent the acid from entering the esophagus where it can cause injury to the lining. You can imagine, if you have acid at the wrong place, you get acid on your skin, it can burn. So similarly, it can burn the insides. So when this barrier gets compromised, then acid tends to reflux up into the esophagus and cause injury. We call this esophagitis. It can lead to a precancerous lining called Barrett's esophagus, which exposes the patient to long-term cancer risk, which is devastating. And then they have to be on this chronic medications that now switch off these acid pumps in the stomach. They're called PPIs, or proton pump inhibitors. And they're very effective. But the problem is that it's a lifelong issue, and patients have to be compliant. They have to be taking them every day. And there's a lot of trepidations because drugs have side effects, and patients don't like to be on those. And when these patients are offered alternative options like surgical interventions where you have to actually go in and uh, alter the anatomy and surgically fix it, then that seems very daunting to patients, and they don't want to be under the knife. So a middle ground approach where we could go in and maybe restore the function in a manner which is, say, less invasive, where the patient comes into the office, the procedure is done, and they go home the same day, is very appealing. So I think AscentX is developing an area which is strongly lacking at this point.
Your website says regenerative injectable biomaterial platform technology, which is definitely a mouthful. So this is an injectable biomaterial process, is that correct?
So what we've tried to devise is a uh, material that the body does not look at as foreign material. Rather than that, it looks at it as friendly scaffolding, where the body's own tissues come in and lay collagen and then recruit blood vessels. So you end up with a living matrix. So the important things are that it needs to be stable so it doesn't migrate. It needs to be large enough so that it doesn't get into lymph nodes and other structures whereby it can cause reactions, and it doesn't cause any local inflammation. So this material tends to act just like when you're building a house. You construct those scaffoldings, if you've seen, and then you can lay a very nice surface on the house. So similarly, we want to create this tissue within the esophagus, which is now acting like a barrier, a physical barrier. And what it's doing is it's augmenting the function of the lower esophageal sphincter that has been lost because of the derailments in the anatomy.
After this treatment, is the problem solved or is it just minimized or reduced?
Well, the problem can be pretty close to being solved, but can it be completely eliminated? It's very difficult because there are mechanistically so many different structures in the area. We are not really fixing those structures. We are specifically aiming to provide the lower esophageal sphincter with a barrier. The lower esophageal sphincter is still continuing to function in its innate state, but the barrier that is provided by this therapy is helping the lower esophageal sphincter in such a way that uh, reflux that may be occurring because the sphincter is not functioning properly or is relaxing too often, then the barrier kicks in to prevent that acid reflux from going into the esophagus.
So, what are the timelines happening right now with this biomaterial platform and moving it forward to market? Where are we at now, Dr. Sandhu?
So we were designing the needle, the delivery system. There was never a study done on having a proper needle with physical characteristics that would assist in depositing this material in the correct anatomical space, which is within the submucosa of the lower esophagus, right at the junction. That needle has now been fully designed and has been patented. Our next step now is going to be doing animal experiments and injecting this material and then studying it at 30-day intervals and then at 6-month intervals to see the efficacy of its ability to uh, be deposited in the correct anatomic location, to maintain its position there, and then to study the tissue that regenerates around it. So once those results are available, then we can proceed to clinical trials and FDA approval.
This is a company that's actually been around for 30 years now. And Dr. Sandhu, is there a question that you wish more people would ask you about GERD that you would just love to answer?
I think I already get so many questions about GERD that I realize that patients are frustrated and especially frustrated with this gap in treatment between medications and invasive surgical approaches. I understand that there's a transoral incisionless fundoplication that's having success, but again, it requires the patient to be under general anesthesia in this in a procedure suite, uh, and then endoscopically altering the junction between the esophagus and the stomach. So it takes time, it takes expertise, it requires training. What we are talking about is a simple endoscopically directed injection, which almost every gastroenterologist does in their practice for different reasons. And once we can adapt this technology for that kind of an approach, then it can be embraced by a large number of gastroenterologists in a short period of time with less training than the alternative procedures require at this point.
We are so grateful today for an update on this minimally invasive treatment for GERD provided by Dr. Sandhu from AscentX Medical. For those of you seeking more information and following this solution, please go to the following website, and thank you for joining us today.
Thank you very much.